Okay, so first question. You are developing a European framework for high-quality cancer survivorship care and rehabilitation that could be promoted at the EU level. Why is survivorship so an important topic?
Survivorship over the past decades have become a hot topic in Europe, but not only in Europe, but also across the world, because you have an increasing number of survivors, and this is due mainly to the aging process of the population across the world, but also thanks to the early diagnosis and also the effectiveness of the therapy.
And what do you think, in what way could then the survivorship care plan improve the quality of cancer care?
The way we wrote the survivorship care plan in the chapter on survivorship and rehabilitation as part of the Cancon guide is just one tool out of the many recommendations we are putting forward. The survivorship care plan should be delivered to all patients after a multidimensional needs assessment. Then it should be elaborated by a multidisciplinary team composed of oncologists, psychologists, but also primary care professionals, social care workers, and in that way it should be also accessible to all healthcare providers dealing with the patient. So in that way, quality of care could be enhanced, and also the quality of the coordination of care could be improved for the patient. And in that sense, it should improve the overall quality of care.
Well, as for follow-up is elemental for survivorship, what is the current situation regarding this in the EU, and do member states have a common system for this?
Actually not. We launched a survey earlier this year in some of the partnering European countries of this work package 8 of Cancon, and 9 countries responded. And what is very striking when you read the answers at first is how different follow-up is organized and also implemented in Europe. So there is no common framework, there is no common tool for this. This is why we are putting the survivorship care plan forward with a minimum set of minimum components of what should be a survivorship care plan throughout Europe. But with this recommendation of a survivorship care plan, we're not trying to sell a common European follow-up method. It's just a roadmap for all European countries to be implemented with their own resources and their own organization as well.
Okay, so what are the equity policies for cancer patients, and how can inequalities in cancer can be addressed?
It's a tough question because cancer survivors are confronted with very diverse and very complex situations regarding inequalities. That depends very much on their personal background, their medical background, the place where they live, the place where they receive care, whether they live in a socially deprived area or geographically deprived area. That very much depends also on the quality of the care and the quality of the care providers they are facing. So there are many sources of inequalities in survivorship. And in this chapter, we are trying to address inequalities as a cross-cutting issue. For example, we're trying to promote the fact that socially disadvantaged people, geographically disadvantaged people should have equal access to follow-up programs, and that they also should fully engage with follow-up programs. We also stress the fact that population at risks, for example children, young adolescents, and also the relatives of these people should also be screened and at very early stages to anticipate their needs and also anticipate the late effects of the illness and the treatment as well. We also touch upon social rehabilitation and employment issues, because when you receive a treatment and when you want to go back to normal life, it's quite difficult to go back to your normal activity because you have side effects of the treatments, for example. It's tough to face a normal work position at some point. So we're trying to address that, and we are trying also to promote good example of regulations in Europe about how to treat survivors in the right way when they want to go back to normal life. We've given example of UK France and Italy, which have very good regulations for that.
Okay, and could you last but not least tell us something about the European Distress Barometer?
The distress thermometer we develop in this chapter is the same thing as the survivorship care plan. It's one tool. It's not another scale or another distress thermometer, but because many exist already in Europe and also in the world. So we are trying to put forward a methodology about how to assess patient needs and patient symptoms to better tailor supportive intervention and rehabilitation care and adapt this rehabilitation care to their own needs. So we say that, for example, it should be symptoms and needs should be assessed as early as possible in the cancer continuum, and it should be also assessed very regularly during the cancer pathway. It should be done by a well-trained professional. It should be done with the consent of the patients and also the relatives, and it should be done with adequate scales and adequate tools. And that's the way we approach it in this chapter.
Okay, cool.